And then
Welcome back. Well, we have a couple of friends on today. We see usually about once a month. It's good to having her. 7-Day Dental. I think a lot of you already know about them. It's always good to get these folks on, Dr. Chuck Lee and Christine Chung. Nice to see you.
Thank you.
Morning.
Great to
Nice
have
to
you
see
here
you.
today. And, we're going to talk about, we got Valentines Day coming up. And so you want to look your best. You're going to have do some special promotions here. And one of them is office bleaching. And you have some discounts going on. First, what is that, by the way? What is people hear bleaching and they think that? Tell me exactly what you do and what is
Bleaching, there's two processes. One you can do in the office where you lay and relax, watch a movie, and there's a light that whiten your teeth.
Okay.
And in-office bleaching can whiten your teeth the most in 1 hour. And the other process is the take-home trays,
Okay.
where we make custom trays. We take impression of your teeth. We make custom tray, and the patients have to wear that with the bleaching gel
Okay.
nightly. And usually we recommend not to wear it throughout the night, just maybe when you're done eating and you're watching TV, or
Okay.
just in between going to bed. And the advantage of the in-office bleaching is in 1 hour it will whiten a lot. The take-home you would have to wear for a few days, usually 2 to 4 weeks, to get a better result. And you can wear as much as you want. If you can wear it for 4 hours, it's better than 1 hour.
Yeah,
but
exactly.
sometimes you do get a little bit sensitivity. But a lot of people forget that. There's a lot, we as Americans, we drink a lot of wine, tea, coffee. It also removes stains, because a lot of patients come to get their teeth cleaned because they see stains.
Right.
And it's so hard to get the stains out of their teeth because a lot of times it's in the grooves.
Sure.
And so patients that come in with a lot of stain, we recommend them to do the take-home bleaching, because in 10, 20 minutes, all gone.
Now, Christine, let me ask you, when it comes to bleaching, people hear that, and they want to know, does it remove enamel? I mean, what's going on? Because people hear the word bleach, they go, oh, do I want to put, Clorox on my teeth here? So explain a little bit more what's happening and how safe it is.
Yes, very good question. Yeah, everybody asks the same question before they actually do the bleaching. It's a very invasive treatment. It does not remove your enamel or any tooth surface. The product itself contains some of the ingredients that penetrate into the dentin tubules, open it up, and then brine it.
Okay.
And in the office, when we do the process, with the help of the light, intensive light, the heat will speed up the process. That's why in 1 hour you can instantly see your teeth get a lot whiter. Some patients have good results that wind up to 4, 5, or 8 shades instantly. Yes. However, like Dr. Lee was saying, because of the habits, you eating, you drinking, so within days or weeks, it might bounce back a few shades. Therefore, we would recommend to have the custom trays, and then you wear it to maintain it at home after the procedure.
Okay.
So we really educate the patient that, because I don't want them to have high expectation after they leave the office, and then with the eating, they start to see some brown spots or stain. That's because of eating.
Yeah, and that's what I was going to ask. It's how long does it last? It's no different than if you
like exercise plan.
Yeah, or you clean something at your house and it's all bright and shiny. Well, guess what? You're going to be using that again, so it's not going to stay that way indefinitely.
And a good thing to remember, if your teeth are really yellow here and this is white, it's going to move all the way to here. And in order for it to come back to where you started, it takes many, many months to years to get back there.
Oh, really?
Yeah, so but the thing is, we all realize, once your teeth are white, it just moves a little bit, you get upset. You're like, oh my God, my teeth are yellow again. But you don't remember yourself really dark teeth.
Right.
So that's why the maintenance program is very convenient. But a lot of people, being that we're busy, they don't like the trays. So
Right.
they will come in every 6 months and do the in-office bleaching.
Yeah.
Because they
Yeah.
just don't have the time.
Yeah.
Now, what about if people, did you ever have people that come in and say, well, I want my teeth a little bit whiter, but I don't want them like perfectly white. Can you adjust that?
Yeah, that's where you do
Did
the
you have
take-home.
those questions?
That's how you do the
Okay.
take-home.
Okay.
So we have a lot of patients.
So then
that-
it goes slowly.
That's right.
Yeah.
Yeah.
Okay, I
You
get
can
it.
titrate the bleaching
Yeah.
process. So we get a lot of patients that are redoing fillings in the front, or doing veneers, or doing crowns in the front. We always tell them to go ahead and bleach their teeth at that time, because once you,
Right.
if you don't bleach, your crowns cannot whiten later. So you want to make sure you're getting the crown color that matches the color that you want to have. So,
I get it.
So
Yeah.
it's always
Yes.
recommended to do that
Yeah.
when you're doing any aesthetic or cosmetic procedures in the front.
And
Okay.
right now we're running a promotion because of Valentines. You know, you can buy yourself a bleaching, and then people who you care and love, you can buy the second one, and we give a great discount. Also, we will include, usually if you do in-office bleaching, follow with the custom tray, it will cost you a little bit extra, but because of Valentine, we'll honor with the bleaching in-office, and you get a
Okay.
take-home free trays.
Very good.
Yeah, till the end of February. So that's the promotion. Give us a call and
Okay.
we'll explain in details if you're interested.
And also, you know, other cosmetic makeovers, veneers and crowns, implants, of course, we've talked about. But you have free consultation on that, and it's some special pricing as well.
Yes.
Yes.
Yeah.
Yeah.
And as far as what are veneers, by the way? I hear about them, but I don't even know if we've talked about that before. Maybe.
So a lot of people say, well, why do we need veneers?
Yeah.
So I think two reasons. One is, as we age, our teeth wears down.
Right.
And so, as you know, when your teeth are worn down, that you look older. So veneers will rebuild the vertical in your teeth, increase the
Oh,
vertical,
okay.
and make them longer, so that you can rejuvenate. You have a younger looking smile.
Yeah.
That's one. And the second reason is, as we age, your gum also recede. So when your gums recede, you start to see black triangles in between your teeth. And a lot of people don't like that, because that's a sign of aging. And so veneers, we will build it out so that it closes those black triangles.
Oh, I see.
Yeah.
Okay.
So those are the mainly two reasons. And because you know, the bonding techniques and just of the veneers now, so there's less chance of debonding,
Okay.
and patients are very happy. And usually you do veneers, it will last you anywhere from 10 to 20 years.
Wow.
Usually people change veneers because they're tired of that color, or they're tired of that look, and they want a new look.
And they can be taken off?
Oh yeah.
Oh,
we
okay.
just you know, veneer, you remove very little teeth structure, and we numb just so that the patient's comfortable. But it's very conservative, and it's a great
Interesting.
procedure.
And of course, you know, this is the time of the year. Think about it in January, and then maybe again in around June or so to get your checkups done, right?
Oh yes, we stress enough. It's so important that you do come in regularly for your checkup, especially some elderly patients. If they're on a list of medications,
Right.
we need to go over that with them. What are the side effects? Because a lot of them cause dry mouth.
Yeah,
And
definitely.
you can elaborate on the
Yeah.
dry
Yeah,
mouth issue.
Dry mouth is probably the number one problem with, because after you're 18, you're not supposed to get the cavity. So usually,
You're not supposed to.
Yeah. But I've witnessed one patient less than 6 months, and she had cavity in all her teeth.
Wow.
At the neck, because remember, saliva acts as a cleaning agent.
Right,
So
yes.
it cleans your teeth. So when you have less saliva secretion, it doesn't clean as well. So you'll get food embedded in around the gum area.
Yeah.
And you even sometimes brushing, you just can't remove all of it. So that's where you get the cavity at the gum line. And when you have cavity there and we don't aggressively move, it can spread, because a lot of older patients have receded gums, so there's no enamel. It's all dentin, very soft tooth structure, and you can get cavity easily. And once you get cavity at the gum line and you don't treat it early, they usually turn into root canals.
Yeah.
Or extraction, because it's just so hard to treat those kind of cases.
Yeah.
And the other thing we like to stress is, oral cancer screening. It's very important. Some patients have a denture or a partial that they're wearing, and it's irritating their tongue or their cheek, or they're biting their cheek biting. We want to get rid of that, because if you irritate your gum too many times, or your cheeks, or any part of the mouth, you can cause the cells to start multiplying in the wrong direction, which can cause oral cancer.
Right.
So a lot of times we like to see the patients usually every 6 months. Now, if they have teeth and they're having issue with their gums, they want to come every 3 months. And I think that's really a good protocol. It's kind of like getting your hair cut or your nails done, So I think it's really important that patients come regularly, even if they don't have pain, because that's why they don't come in.
Yeah, exactly. All right, well, you folks are located right nearby here, and the number is 949-859-3988 for the local office here, by the way. 7daydental.com is the website. Doctors, thank you very much.
Thank you.
Good to see you.
Nice to see
And
you.
Happy New Year too. Yeah, haven't seen you. I haven't seen you for a while.
Yeah.
You've been on by yourself a couple times. Good to see you too. All right, we'll be right back.